Hi everyone, greetings from the my channel Medical Matters. I am Dr. A.K. Shrivastava. I am a public health specialist, preventive medicine specialist, and today I will be talking to you about the dengue fever, also known as dengue. Why this is important time to talk? Because this is a monsoon season, and in monsoon season the mosquito-borne disease and the waterborne diseases are at the peak. The environment is very suitable for that. So let's talk about dengue. Dengue is a kind of viral fever which is caused by a particular virus, flavivirus. Let's call it as a dengue virus. There are four varieties of this, and it is possible for you to get infected by one, later on again infected by some other virus. The infection by one particular virus gives you immunity only from the one particular type of virus, and you are again susceptible to other kinds of disease. Now this can present you in three forms. Number one, it can present you just a viral fever, dengue classical fever. It can present you with bleeding tendency, that is dengue hemorrhagic fever, or it can present you as a shock, hemorrhage and shock. And if not timely provided right kind of treatment, it can result in fatality. So it's better that we take precautions and save ourselves from this dangerous disease. Now this disease spreads by a mosquito, and this mosquito is called as Aedes mosquito. There are certain peculiarities about this Aedes mosquito, and these peculiarities also make it more efficient as a vector, but also make it easy for us to control if we start taking action. Now this mosquito has a black body with the white stripes on the body and the legs, which gives it the name tiger mosquito. The female of this species is a very fearless biter. It bites in the daytime, and also it has a habit of biting multiple people. So it results into cluster of cases. That means it is more efficient in spreading the disease. Now another thing which is important for this mosquito is that its breeding habits. This mosquito breeds in artificial containers in and around our houses. That means it breeds next to the human dwelling. It resides in the human houses and it bites people. Now the places to look for its breeding are the unused cooler, where there may be some water lying, flower pots, discarded tins, broken bottles, tree holes, any place where the water collection is there, like you have a plates under your gamla. All these things, wherever the water can collect. Discarded material lying on the roof is ideal places. Discarded tires. So these are the places to look for its breeding. Now number two is, how do we recognize this disease? It has after bite of a mosquito, it takes about 5 to 6 days, and then you get a fever which is very high. It comes with the chills. It is associated with intense headache, joint pains, muscle pains, bone pains, and it makes you almost very difficult for you to move. You have to lie down. Another very characteristic feature of this disease is that there is a retroorbital pain. That means when you move your eyes for the movement, you feel a deep-seated pain behind your eyes, and that's a very characteristic feature of this. It develops within 24 hours, and in some of the cases the person will develop into rashes. These rashes are due to bleeding into the skin, and this bleeding, if it goes high, it can result into lower blood pressure and shock. So these are the clinical features which are very easy to recognize: intense headache, retroorbital pain, that is the pain behind eyes, and very high fever, the person looking sick. He may have stomach pain, he may have vomiting, which may not be generally known as classical symptoms, but people can have this. Now what to do with this? First is that order some basic investigation must be done. Even if you plan to make home management for some time, some basic investigation must be done, like hemogram must be done, and rapid tests are available for dengue. It can be done. Now, for the home management, I'll just emphasize on three things. Number one is plenty of fluids. Use ORS, oral rehydration salt, for rehydration. 120-gram packet to be dissolved in 1 liter of water, and the person should take it at libidum. That means whatever he wants to drink, he should be allowed. Have fruit juices, soups, or any kind of water. The water and electrolyte composition or maintenance is very much required. Number 2 point to be remembered is that do not use aspirin or any other non-steroidal anti-inflammatory agents for this fever, because this can bring out bleeding and it can be very dangerous. So never give this. Use only paracetamol for the fever. Paracetamol 600 milligram can be used 3 times a day, and if it is still required, then wet sponging or cold sponging must be done. Now, another third point which to be remembered is for home management is when to refer, when to consult a doctor, when to immediately go to the hospital. That is, if the patient is not improving, his vomiting is continuing, his pain, his stomach is continuing, he is feeling very sick, he is not passing urine for 6 to 8 hours, or there is a bleeding in his skin, or there is a bleeding in his stool, that means he is passing black color stool, or as such you are feeling that patient is not looking well, you must immediately consult with the doctor. There is no further role for home management. Now, the time comes for the prevention. What to do for prevention? For prevention, there are two aspects to be cleared, or rather three. Number one is stop the bleeding. Number two is save yourself from the bite. And number three is vaccine. So for the bleeding, we have told you the spots to look for. The Delhi government has controlled the dengue at one time with the slogan that 10 minutes, 10 weeks at 10 o'clock. That means every Sunday at 10 o'clock or whatever time you fix it, you look for a house, look for any discarded tins, bottles, coolers, etc. Whatever points I have said about the bleeding, look for them, dry them if there is any water collection, and let it absolutely dry, wipe it clean. This will stop bleeding, and if it is done by people in community, everyone, then it will be very effective. Otherwise, at least you do your bit. Number two is how to save yourself from the bite. This mosquito is daytime biter, so only using of mosquito net in the night will not save you. You have to use full sleeves clothes, full length pants, use Odomos kind of thing or mosquito repellents. Whether you use mosquito repellents, liquids, or ointment or roll-on kind of thing on your clothing, whatever you do, you have to save yourself from the mosquito bite. If there are children and infants, if they want to sleep in the daytime, they must be under the mosquito net. The patient should also be managed under the mosquito net. Now, another thing which remains is that vaccine. There is a vaccine available from Sanofi Pasteur. It is CYD TDV is the name. You should not do self-medication. For this, you must consult a doctor. But these 3 doses are required 6 months apart. Now, in the end, I want to say that 2 things you have to remember: stop the bleeding and save yourself from the bite. This disease is very dangerous. It can be a killer. So this is all from me. Please, whatever you feel like, you do ask in my comments and do ask questions. Thank you.